Hi, I'm here with Dr. Siddarth Sethi, gastroenterologist and hepatologist. And in this video tutorial, we're going to be talking about something very topical, and that is autoimmune disease and COVID-19. And specifically, do individuals who have autoimmune disease, are they at a higher risk of going back into the workplace given the challenges and the dangers of COVID-19? Dr. Sethi, what's your experience and thoughts on this?
So thanks for inviting me to speak today. So autoimmune diseases are a very common condition in the population. They affect almost 1 to 2% of the population. So they typically affect females more than males. A lot of males do have them. The typical autoimmune diseases would include rheumatoid arthritis, inflammatory bowel disease, or thyroid disorders. The other ones include psoriasis. So such patients will often be prescribed immunosuppressive medications. They may sometimes claim that their autoimmune disease and the medications they're prescribed put them at high risk of developing COVID-19. Then in some cases argue they should be permanently allowed to work from home. What they're arguing is simply anecdotal. It is not supported by any scientific evidence. The general consensus medical opinion is that patients who have autoimmune disease or who are on immune suppressive medication are not at high risk of developing COVID-19. They develop it at the same rate as anyone else. It is definitely not a higher rate. And even if they were to get autoimmune disease, they don't seem to have a different disease course. So the disease course behaves just the same as it would if they didn't have autoimmune disease. So it's not a more aggressive or more prolonged illness.
So it's a really interesting question, isn't it? No doubt a challenge that is going to be posed to us more often as we move forward and people are starting to now return back into the workplace. Yes. I have autoimmune disease. Am I at higher risk of returning to the workplace given COVID-19? And I guess the answer is there's no evidence to show that at this stage.
That's correct, and absolutely no evidence to support that whatsoever.
Great, thank you for that. That's really interesting. So Dr. Sethi, thank you for joining us for this video tutorial.
Thanks for inviting me, Sue.
Dr. Sethi is of course available to provide his expert medical opinion to any referrers and can be booked through the MEDirect platform on www.medidirect.com.au, and his specific webpage is shown on the screen now. Thank you so much, Dr. Sethi.
Thanks, Sue.